Hey,
How's it going?
oops. Just
Well, hi, Bradley.
Hold on.
You're the one that hit. Were you the one that hit record?
Yep.
Okay.
Just
All
didn't
right.
want to forget.
What you
Huh?
say?
Yeah. Yeah. Hi, Chris.
Dale, how the heck are you?
Feeling like a million pesos, brother. Just feeling like a million pesos.
So about 700 bucks.
About, give or take. Yeah. Yeah. So-
That's awesome.
yeah. How about you?
Million hryvnia, I would say.
Yeah, a million hryvnia, which is
Yeah.
that better or worse than a peso right now?
I'd say right now it's probably better than a peso.
All right.
Um,
That's not saying a whole lot, but
Not saying a whole lot, but
mm,
it is what it is. No, it's been a day.
really?
It's been a day. Yeah. Yeah. So
Are you well, Brad, is it snowing in your side of town yet? We're expecting snow tonight.
oh, we are not expecting snow here.
Yeah. Yvonne, are you expecting snow today?
we are, yeah, it's pretty windy.
Yeah.
Um, Actually, I don't know oh, maybe that's better. I don't know. There's a huge window right here beside me, so there's some glare, but whatever.
Yeah.
No,
Need to remind everybody we are recording. So.
we had our 1 day of snow, but that was we should be good for another 20 years. It had been, yeah,
Hey, Brad.
it did snow. It was 1989 last time it snowed, and then it snowed this winter.
Where's
Yes.
Brad? Brad,
Yes.
can you hit pause? Can you pause the recording? Our medical advisor.
Okay.
Okay. I'm gonna start letting people in. You ready, Chris? And
I
Chris is
am.
our facilitator.
I'm happy to be. Would you do the introductions though, since I don't really know
Yes.
everybody?
Yeah.
Thanks, Dale.
Yeah.
Hi, everybody. Can anybody see me?
No, I mean someone might be able to. None of us on the call can.
Yeah.
Does anyone in the
Oh, I
room?
gotta turn this button on.
Yeah.
Shows you how much I
Turn your
do this.
camera on, Fiddler. There
There,
you go.
there
There
you
we
go.
go. What's up, Dave?
Hey, well, hi
Oh,
everybody.
the,
Welcome to our monthly Zoom chat about how to prepare for your adventure this summer in the San Juans. And uh, this month we are going to turn our attention to all things medical, and we've got a great panel. Of course, you know our 17-time finisher, facilitator, podcast co-host Chris Twiggs. He will be uh, running the show from here on out. We also have our medical advisor, Dr. Dave Hughes. We have our medical coordinator, Dave Fiddler, and we have Dr. Yvonne Naughton, who I should say Dr. Dave Hughes as well, and Dr. Yvonne Naughton, who came to Silverton to run Hardrock and loved it so much that her husband stayed, and now are creating and providing medical services in the town of Silverton. So we're glad you're all here. We do have some questions that you submitted, but uh, we will also be monitoring questions in the chat, and I'll be making sure that Chris sees those as well. So, Chris, it's all yours, buddy.
All right. Thank you so much, Dale. I really do appreciate people being here live, and I understand that there's some people that couldn't be here during this session. So it is being recorded and it will go up on our YouTube channel so people can watch this later. So if you submitted a question, but you're not here now, maybe you're here now, later, watching this on YouTube. And hopefully all of our runners will have the opportunity, Hopefully all the runners will take advantage of the opportunity to watch these things because the last thing you want is to get to Hardrock after all the years of dreaming and hoping and putting into the lottery and then have something take you out that is preventable. So we're going to talk a lot about things that might be preventable, things to look out for while you are here in the San Juans, and then what might happen if there are emergencies that come about. So I'm going to start going through the questions that we have here that were already submitted. And as Dale said, he's going to look at those questions that come in through the chat. So we're sure that we do not get anything, so nothing is missed. And the first question that I am going to ask is, and I think this is a good one. I think a lot of people have this question. I actually, when I said here in the San Juans, I'm actually at my home in Florida right now as we're recording this. And so a big question that I had before I came to Silverton, Colorado was, how can I tell if I am being medically impacted by the altitude? And that was a question somebody submitted. So I'm gonna start, because before we even get into the run, people will arrive in Silverton. So Dr. Naughton, what will people notice coming to altitude, and what would you say would be the line between being impacted by the altitude and being medically impacted by the altitude?
Well, I think when you come first, like you'll definitely notice just the difference in the availability of oxygen, and a simple walk up what you might run a hill at home is gonna feel like, your heart's pounding, you're feeling a little lightheaded, your quads are heavy. Those are definitely some of the symptoms that I would have felt first when I came to altitude and tried to run. The flat, you will definitely feel slower. Downhill, is manageable. So definitely just those kind of symptoms: a little short of breath, lightheaded, heavy muscles. Um, but that is just, the symptom of, the oxygen, and what you're used to at a lower elevation. If you're moving on to actually experiencing like altitude sickness, during Hardrock, it can be hard to differentiate between that and mid 100-mile race. You're gonna maybe have a headache. You're gonna maybe feel like you're a little bit altered mentally. You're not gonna want to eat. Maybe you're nauseated. You're throwing up. So that's going to be a little bit difficult to differentiate. And we have medical volunteers who are watching everyone that comes in, and if people just aren't acting appropriately, I think leaving it to the skilled hands of the medical volunteers who are at the aid stations to differentiate that. But definitely, if you're feeling something that's different than you felt before in a 100-miler along those lines, it would be important to let, the medical staff at an aid station know when you come in. So yeah, it can be a fine line between what might be a normal 100-mile experience versus altitude sickness in the middle of the race.
Yeah. Dr. Hughes, what would you say as people during Hardrock, as they're coming through, what are the sorts of things that you would want them to communicate to those medical volunteers at the aid stations, and how are they going to be evaluated to make sure that they're experiencing normal, if there is such a thing as normal, this is how one feels during Hardrock, versus an altitude incident?
Yeah, so there's kind of a gradation. You have, just the discomfort of altitude and, more short of breath. That's everybody gets that. But as you get more progressive to what's called acute mountain sickness, where the headaches, the nausea, dizziness, that's not life-threatening necessarily until it becomes to the point where you are so disoriented that you really can't make good decisions. You can't, if you start having any focal deficits, like you have weakness in one area, or you're having trouble walking, or I've actually seen people at Hardrock who've had blindness, and that's what we call it, just a transient neurological deficit at altitude. But if anything like that, that's a big red flag. You need to communicate that. Don't try to gut through that, because that can be permanent. The big differentiation: it's very unlikely to have cerebral edema at this altitude. You have to get up into the more upper like Himalayan type of altitudes for that, but you can have these transient deficits. The other big thing with pulmonary edema is the one we can see that. And I would communicate, if you have a cough that's, especially if there's blood in it, or if you're really just, bring up a lot coughing. One of the big cutoffs is if you can't catch your breath at rest. So if you get to an aid station, you sit down, you rest for a little bit, or you get to a top of a hill and you rest, you catch your breath. That's kind of a good thing. If you are at the point where you can't even take more than a step and you're still trying to catch your breath, that's a big red flag, and you should be evaluated at that point.
Yeah. We had a similar question, and Dr. Fiddler, I'll direct this to you. Someone asked, at what point should we worry that gunky and raspy lungs might actually be high altitude pulmonary edema? I'm a layman, but I would think gunky and raspy lungs are probably never a good thing.
I'm just thrilled that I just became a doctor.
I'm sorry.
So no, where's my paycheck? I'm just springboarding off of what the two previous doctors were saying. I totally agree, and as most of you know, I've worked up here forever, and altitude sickness is, is a vague thing. It's hard to say, yeah, you have altitude sickness. I don't know, but you feel like crap. And with the Hard Rock, we tend to very much err on the side of safety. So if people are coming in with flu-like symptoms or anything, it's like, I'm not going to rule out altitude issues. And there's two ways to deal with that. Well, maybe one and a half, put them on supplemental oxygen, see if they get better, or just go down. Go down to Durango. If it's altitude, it's all going to be gone. And when we transported altitude sickness patients from up here, by the time we got to Cascade, 8,000 feet, it's gone. Um, as far as raspy lungs, again, um, err on the side of safety. I mean, if we deal with people with junky lungs, that's yeah, we're going to do something about that because it's not going to get better as they're running the race.
Yeah.
And so I agree with everything the other doctors are saying, the headaches, the nausea, the vomiting, could be anything really. But if they come up to us or we could go up to them and say, "Are you feeling okay?" and they're not answering properly, that's a problem. Yeah,
Yeah.
I know running 100 miles is difficult and you might be a little wonky. Well, you're wonky just to get into the race. But if you're not feeling well, we're going to act one way or another, whether it's the aid station people or the people here in the gym or Silverton EMS. Um, so it's not a black and white answer, but it's definitely something we're all used to seeing, especially the medics that work here. They see it all summer with the trained people.
Yeah. Let me stay with you just for a second because you're
Sure.
talking about the medical stuff that happens at the aid stations, and somebody did want to know what sorts of medical supplies can they expect to find at the aid stations and
Well,
medical help.
yeah, every aid station, there's going to be a variety of types of personality aid stations. We've got doctors. Well, last year we had a pediatric oncologist who said, "I don't know how to do anything, but I can do CPR." Which is fine. I mean, and they're great people. And so we'll have paramedics, we'll have PAs, doctors, NPs. We just don't know exactly where they're going to be ahead of the game because, our volunteer coordinator places those people, and they're usually at the same place every year. They all have access to obviously radios, the ham operators that have access to me and the gym. And then we have access to Silverton EMS, Silverton Search and Rescue, and air support. So we've got everything from mobile ICUs to a Band-Aid. And then, of course, every aid station will have their normal blue bag of just kind of first aid stuff.
Yep. Yep.
And every year I've been, listening to the aid station people saying, "Hey, can you add this? Can you add that?" If I can, I will.
Yeah. Um, Dr. Naughton, what are some things that people might do now or at any point to prepare? Are there things they can do to prepare to come to altitude?
Well, I guess if they can get a little bit higher than what they're at, if that's something that's available to them. Some people will use sauna training closer to the time. That heat is the poor man's altitude. Um, and yeah, I think just closer to the time, like before you travel and as you're coming into town, just making sure that you're, well hydrated. Maybe just watch things that are going to dehydrate you, alcohol, coffee, sun exposure, definitely, but staying well hydrated. And if you can travel, slowly, if you are driving, take a couple of days to gradually get to Silverton, maybe do some runs as you travel, as you're gaining altitude. If you're flying in, maybe you're flying into Durango or Grand Junction, Montrose, maybe stay there, for a day or two, do some runs there before you come up and just, go a little bit more slowly. Um, but I think it's most of the preparation will probably be closer to the race time as opposed to kind of this soon.
Hmm. Hmm. Um, Dr. Hughes, what would you say ideally for somebody to arrive prior to Hard Rock? How long would you like them to be in the San Juans to minimize these types of impacts?
Well, it really depends on the person. I mean, people who are prone to acute mountain sickness who have had problems in the past probably wouldn't be bad for them to get there at least 3 days earlier. It takes about 3 days for people to acclimatize. But somebody who may have had worse problems, maybe a little longer. But it really depends on the person. So, but yeah, 3 days would be good for anybody who might be more prone to altitude sickness.
Dr.
Okay.
Hughes, I have a question, or Dr. Naughton, I have a question. What is your opinion on getting a prescription for acetazolamide for people that have had an issue?
My
Hmm.
thought on that is so acetazolamide, if you've had a problem in the past, it can be helpful. The problem with it is first of all, it makes all carbonated drinks taste flat. That's not a big problem, but it can dehydrate you. It can act as a diuretic, and so it probably I think its benefit may be equalized by the risk of being dehydrated. So I'm not sure that's going to be a great one unless you've done that in the past before an altitude race and it's worked fine. Probably wouldn't try it for the first time for this race.
Dr. Naughton, do you have any opinion there?
Yeah, I think the same, just not trying something new like that for the first time. And yeah, the fact that it can, you're gonna have a diuresis and you're already trying to make sure that you're staying hydrated. So, I mean, yeah, if you've had an issue before at altitude, if you've used it before, I mean, it's not a performance enhancing drug. So so yeah, but I don't think I'd try it for the first time coming into your first hard rock.
Okay, so a follow-up question. What are your thoughts, Dave, especially since you're the medical director, about having nifedipine at the clinic if we
Uh,
have if we have a acute mountain sickness that we'd like to treat? Or would it just be throw them in the ambulance, let them go down?
yeah, it's probably going to be the better option. Trying to, the biggest thing is if you've got somebody who's got pretty severe altitude illness, we're going to be transporting you down to Durango to an emergency hospital anyway. But somebody with just mild illness, that's usually nifedipine is not going to be used for just mild illness like that. But yeah, having it at the clinic, that would be probably a separate discussion. Just seeing there's some logistics with that. So
And that could be Dr. Brown's issue
right.
if he's available.
Well, I didn't understand all of that, but I don't have my emotional support doctor wife in the room with me, so I can't get a translation. But I did hear somebody say something about dehydration, and that does lead us to another question. Dr. Hughes, are there any guidelines, medically speaking, for hydrating at Hard Rock? We know, I mean, a lot of our runners, all of our runners have done a 100 miler before, and so they know they need to stay hydrated. But considering the altitude, considering the environment being there in Colorado, and the time of year, do you have any guidelines or any recommendations about hydration?
Yeah, just I think that the experience people have had with previous 100 milers is going to be a little more profound with the altitude. That will dehydrate you more. Depending on what the weather is doing, it's probably going to be dry, much drier than people are maybe used to if they're coming from more humid areas. So it's just going to be you probably want to increase the fluid intake, but as you want to make sure that's balanced with electrolytes. If you just take pure, just free water, that can cause problems and this, people becoming hyponatremic where their sodium gets real low. The study they did with the Boston Marathon, that's people who probably aren't really used to doing races, and that's not really an issue for Hard Rock. But just don't jug, don't go chugging 3 gallons of water the night before. That'd probably be the biggest thing.
Okay. Okay. And then with as far as electrolytes are concerned, I mean, I know we know there's going to be tailwind on the course, but would you recommend people carrying salt tablets in addition to that, or you think that's probably not necessary?
I think it just kind of depends. Everybody is as they've trained and done previous hundreds, they've probably seen what happens. I mean, I've just seen people, overdoing on the salt and coming in looking like a pretzel stick to an aid station versus the other people that I think the Hard Rock, one of the biggest challenges with Hard Rock, I've decided more than a cardiopulmonary challenge is going to be the electrolyte issue and your kidney function. And it's really easy to have muscle breakdown, and with that, with dehydration, that can cause some pretty bad kidney injury if you aren't careful with that. So, just having a good balance, with what you have in the tailwind is pretty good with sodium content, but it's probably wouldn't hurt to use some supplemental electrolytes as well.
Okay. Okay.
And
Um,
just a sidebar there. This is just kind of an overall view. I mean, the runners come in, and most of them come in with crews. And so when we're at the gym and we're watching people, we're not only watching the runners, we're watching all their crew also, because a lot of them aren't considering things like dehydration. And of course, in Silverton, it's relatively dry, and of course, it's high. So you're breathing faster, your heart's running faster, and we sometimes see people that are just milling around, not looking so healthy. And so making sure people know that just being here, just existing at this elevation is going to dehydrate you. And so, I mean, the aid stations take care of all the runners, and let's face it, the runners know how to take care of themselves, but their crews, not so sure.
yeah, I'm glad somebody's watching the cruise as well, and the families that are there. Now, water, obviously, we talked about needing to hydrate and taking in water, but there's also a lot of water out there on the course, and wet feet are something that we've talked a lot about. People are concerned about having wet feet for the whole course. As they're coming through the aid stations, is this something they need to be concerned about? Is this something that's going to cause them a problem? Is somebody going to DNF Hardrock because their feet got wet? What do you think, David Fiddler?
I think this would be a better question for Dr. Hughes, who's a runner. But my guess is that if your feet are uncomfortable, you probably should change your socks. That would be my guess. But Dr. Hughes, chime in here. You've done this 100 times, 1,000 times.
Well, no, I've never done a Hard Rock.
No, but
Done.
you've run.
Right, yeah. So I've only done 100. That's a Wasatch 100. That was this last year. I swore I'd never do 100. And the main reason why is because I saw a guy at Cunningham with his feet. I saw his feet. They looked like trench feet. And so it's really interesting you brought this up because this is what made me decide I will never do a race like this because having wet feet is horrible. So I would advise everybody to have, a few pair of change of shoes because this is not a dry foot race by any
Yeah.
means. Even though
All
it's going
right.
to be a drier year than usual, it's still not going to be dry. You won't have dry feet. So having that change, yes, you could definitely DNF because of your feet being too wet. You just basically have all this breakdown, and you're going to have feet that look exactly like trench foot.
Yeah.
And we
Dr.
definitely ran in blisters last year.
Yeah. Dr. Naughton, you have done Hard Rock.
Yeah.
What was
I,
your strategy with regard to wet feet, and what's your consideration on all of this?
um, I always I think having the appropriate size shoe first, you'd be surprised how many people like their shoe is like maybe a half size too small. Having toe room. Then I always like to use a barrier cream like petroleum jelly, something like that. I know 10-time veteran Jeff List, who I've paced twice, would use a zinc oxide like paste to as a barrier cream on his feet and changed his socks and put the cream on at every aid station. I don't know. I like the petroleum jelly and Gingy toe socks, keeps all those toes separated. My feet have been pretty happy the last 2 years at Hard Rock. I might have changed my socks once. Didn't change shoes. I don't know, they did look a little bit like I'd sat in the bathtub for a day, but once I got the wet socks off at the end, they were pretty happy, no blisters, skin was all intact. So I don't know if you knowing your own good routine that works, and for me, that's like a barrier cream and gingies and appropriate sized shoes that aren't like too tight and just rubbing your toes and giving you hot spots. And I don't know, sometimes it's like it's not even worth changing at an aid station. You go out half a mile and you're crossing a stream and you're like wading through mud, and it's like, okay, there wasn't really a point.
Yeah, it doesn't matter, especially the last segment of Hard Rock. It doesn't matter which
Yeah.
direction you're going. You're walking through a stream uh,
Yeah.
between the
Yeah.
aid
I
stations.
mean, I think have socks in your pack. I always carry one pair because you could do a lot of damage between the time you realize that you need to change and you get to that pair at a drop bag. So I think just having socks in your pack that you can change if something's really getting to you out there. But then yeah, I always have extra socks at aid stations too because I overpack. But yeah.
Um, Dr. Hughes, I know we're going to lose you in a couple of minutes, so we really do
Yeah.
appreciate you giving us some of your time this evening. And we've got some more questions, but rather than ask those, I just want to ask you, is there any medical advice, anything that you want to make sure the runners hear now as they're planning their summer, as they're planning on coming out? Is there anything that you want to make sure you have a chance to tell them?
Yeah, I would just say, listen to your body. Getting through stuff is part of the race. Of course, you have to get through aches and pains and things like that. But if you start having things that don't feel like, hey, chest pain that is, this doesn't seem right, or wow, I can't catch my breath at rest, or wow, I'm peeing blood. Don't ignore that because it's not worth it. I mean, it's not like the world is ending tomorrow. Well, sometimes it feels that way, but the world, you've got take care of yourself so you can run for another race. And that's, I think, the biggest thing.
Yeah. Well, again, thank you so much for giving us some of your time tonight. And I think
Yeah.
I speak for everyone in the Hard Rock family when I say that I hope that Hard Rock is the most boring weekend of your life. So we don't want any incidents that draw your attention during Hard Rock.
Yeah, and definitely everybody pray for rain because having fires would not be a good thing. That could be a DNF for everybody.
Oh, well, absolutely. It'd be a DNS for everybody if it got
Yeah,
to.
yeah, I stand corrected.
Are
Yeah.
Yeah.
you in prison?
Yes, I'm in prison. They let me out just for this.
Behind you looks like you're in prison.
Yeah, I'm just in a minimal security.
David Fiddler, we've promised not to judge people for what's behind them on this particular Zoom.
Yeah, and
I'm
I would
actually,
reiterate what Dave just said. It's something I said 2 years ago in my little stupid talk at the beginning. But the big thing is that if your body is telling you that there's something wrong, don't swallow it. Tell the aid station people, let them evaluate. And the last thing I mean, not every year, but we fly people out of this race. We flew someone out last year. Um, and I flew someone out 15 years ago. It was the best man at my wedding. And if we don't have to fly someone out, it would be great. If you catch it quick, you say, there's something wrong. I'm not feeling well. Tell the aid station people, let them communicate with the medical staff and us and EMS and the doctors, whoever's here, and we'll help make that decision because the last thing we need is some kind of catastrophe on the course, because somebody just wanted to keep running. And I get that. But as Dave said, it's not worth it.
Yeah, yeah.
And I
Agreed.
think as well, like you actually have a lot of time to fix problems. It's not like, it's not a fast 100 that you're going sub 24. You've 48 hours. If you're doing pretty good, but you run into a problem, you get dehydrated, you get a little bit hypothermic, you get to an aid station, that's good. You're not on the top of handies with that problem. Let the people at the aid station help you. We have rewarmed someone like in a truck. We have stuffed water bottles full of hot water down like tops and shorts and like wrapped people in blankets. We've gotten people who haven't peed for 6 hours to sit and drink fluids and pee before they leave, and they've finished and they've actually, you know, gotten their mojo back and finished strong. So, don't rush out of an aid station because it can be a long time between them. On paper, it might be 10 miles, but if you're not doing well, that could be,
Yeah.
who knows, 10 hours. So yeah, take your time and take the advice in the aid station.
I agree.
Yeah.
I'm
Yeah.
going to sign out here. Thanks, everybody. I'm looking forward to see everybody in July.
Thank you so much. I appreciate that.
Bye, Dr. Hughes.
All
Bye.
right. We'll see you later.
Hey, Dr. Hughes, you're invited to my glow in the dark pickleball tournament this 4th.
Okay. All right. Okay. I'll try to be there.
Okay.
All right.
Chris, can I cut in here for just a second?
I wish you would, because glow in the dark pickleball is not where I thought this
Yeah.
conversation was going to go. I will just say my recommendation is no glow in the dark pickleball for anyone who is entered into Hardrock. And if someone who's on the wait list tries to talk you into playing glow in the
Yeah.
dark pickleball, don't
Yeah.
listen to them.
Yeah.
Well, that's a week. It's a week before.
Yeah.
Right there.
Dr. Naughton and Fid, what I'd like you just to talk a little bit about, you mentioned it, Dave, I think in the last comment, or maybe it was you, Yvonne, about kidney failure and and renal shutdown and stuff like that. And that's a huge thing. I mean, that can be life-threatening. So are there warning signs, or how do we deal with kidney functions and renal shutdown?
Dr. Naughton?
Yeah, well, I think definitely the importance of staying hydrated during the race and drinking and staying hydrated. But I mean, you're doing a big mountain 100-mile race, you're going to have muscle breakdown, which the byproducts of the muscle breakdown your kidneys have to deal with, and that can lead to the issue of your kidney problems. On top of, if you're taking something like NSAIDs, like ibuprofen, for pain, that they're processed by the kidneys, so then you're asking your kidneys to do more work. So, staying ahead of any issues would definitely mean, not taking ibuprofen or anything that's metabolized by your kidneys, and then making sure that you are hydrating and keeping an eye on your urine output. Way easier for the guys. I have so many guys who tell me, yeah, I peed whatever an hour ago and it looked like this. But, the girls, it's a little harder, but you gotta, keep an eye on how much you're urinating and what it looks like. If it's starting to look dark and concentrated or like tea colored, that's a problem, and you're going to want to tell people at an aid station. Definitely, if you're peeing blood, another problem. But yeah, hydrating, it's solves a lot of the problems. So.
Yeah, and I completely agree. And, one of the standard questions at the aid stations that they ask people is, are you urinating appropriately during the race? And that I think that would be the number one tip off. If you're running and you're going from aid station to aid station and you haven't peed, you've got a problem. And I flew somebody out of here at Pole Creek with potential rhabdo. Again, just like anything else on the race, it's not something we're going to mess around with. If you come into the aid station and say, I haven't peed, or it hurts, or it's weirdly colored, we're going to take a real serious look at that, because the docs aren't going to let that go. I mean, just it's protection, because that's not something that's going to go away. And, appropriately hydrating with the appropriate electrolytes is definitely going to be something that when they come into the aid stations and they say something about, we're gonna red flag that, because we don't have to fly you to an emergency room for something that we could walk you out, get you hydrated, rested. Yeah, it's a DNF, but you're alive, and you still have kidneys.
So we've talked about electrolytes and fueling, and Dale, we've got a question that is definitely to be directed to you. With Martin joining Hardrock, which we're all very excited about that deal, with that company joining, what electrolyte fuels will the aid stations have? Will it be Tailwind? Will it be Martin? Will it be both? Also, do we have any idea what flavors those will be? And will the aid station have solid food from Martin or just gels? Any of that stuff. Let us know what you can tell us about how that's going to work.
Sure. I know our aid station director is also on this call, so I'll let him weigh in if he'd like to with that. There will be both gels and tailwind in terms of electrolytes at each aid station. We are currently working with both companies to determine what flavors are going to be there, but we will get that information out to people well ahead of time so they know. But if my recommendation is if you're not using Tailwind or you're not using Morton, to use both of those products, or because that's what will be available at each aid station. Or you can also make sure that you bring your own, which is perfectly fine too. There will be water and things like that. And I see Brad just jumped on. So Brad, do you want to weigh in on that?
Yeah. So just a couple things to round out your comments. So Chris, yes, we will have the Martin solids, their bars, as well as gels, both caffeinated and non-caffeinated. And for the Tailwind flavor, that's actually up to the runners. In the next edition of Tommy Knocker Tales, you can look forward to a link for a poll to vote on what flavors you want to see. That's something Tailwind collaborates with us each year, and we want to make sure that we put the flavors out that runners want.
Awesome. Awesome.
They're
Well,
both really excited, and I'll just say they're both really great partners to work with, and they really want to make sure that they provide the necessary things to at the aid stations and make sure that they'll have it on have it on course for everybody.
yeah. And as you said, Dale, folks, try this stuff. Get if you haven't used these things before, get some and use it in your training. Use Tailwind in your training. Use Martin in your training just to make sure, because they are different from any other. Tailwind is absolutely different from any other fluid that's out there. It's not like Gatorade. It's not like Powerade. It's a completely different thing. Make sure you've had it and tried it. I think you're going to love it. I certainly do, and I'm really glad that we have it there at Hardrock. And then the same thing with Martin. It is completely different from any other gel you have ever had. And so if you haven't tried it, get it and try it, and so that you'll know whether you like it or not. And that way
Hey, Chris,
nothing
with
during
that being
Hardrock.
said, that doesn't mean that we're going to search packs and say, oh no, you can't use honey
Well, they can
stinger,
do
or you
whatever.
can't use something that fits, but we're going to make sure that there's availability of both of those products at each
Right.
station. Yeah,
Those are the sponsors, and so we'll have those products there, but people are free to put whatever they want in their
right.
drop bags, or if at crew stations, their crews can provide them. If you know we if if Howie Stern can do most of his hundreds on pepperoni pizza, then we're certainly not going to force people to do a gel that they're not used to. Um, we've got another question, and Dr. Knott, I'll ask you, because this is not just about during Hardrock. I think this is something that's important the whole time people are there in the San Juans. What should they expect in terms of sun exposure, and what do they need to be prepared for as far as that's concerned? Is it what I would do here in Florida, or is it a little bit different in the San Juans?
Well, I don't know if Dale remembers what I said to him when I finished Hard Rock last year. Maybe
Mm.
not. He's probably more tired than I was. I told him I was going to heat train for the next time I got into Hard Rock.
Yeah.
I mean, I don't know. The last 2 years have been hot.
Yeah.
And I paced the 2 years before that, and it was manageable. And I've been a 5-year volunteer out at Burroughs, and we've seen our fair share of like normal, the afternoon monsoons and thunderstorms and everything like that. But the last 2 years have been hot. and kind of like surprisingly so that you might not expect it for like Colorado for Hardrock. And I think when you were out there, especially in the race, like or on your training runs the week or two beforehand, if you're doing that here, you have your crew are out. When you're above tree line, you're exposed. So taking that into account, making sure you've got your sunscreen, you've got your layers to protect you, your hat, your buff, your sun layers, keeping that sun off of you, making sure that you've got enough water with you. I mean, you can have your filter bottle with you, and there is water out there. I'm suspecting this year won't be a year that there'll be snow out there that you can pack in a bandana or your hat to cool off. I mean, 2 years ago, that trek out of Telluride up to Oscars, only for the snow that was still out that on the course. I don't know how many times I packed my hat and bandana, and it was life-saving because just the sun exposure was pretty crazy. So if you're not thinking about it, I definitely think people should be thinking that Hardrock can be a hot race. Last year, rolling into KT first aid station, I got ice in my bandana, and I was got sunrise coming over Handies, and it was hot between 12 and 14,000 feet at like 6:30 in the morning. So yeah, if you're out from tree cover and you're going to be in the sun, it can be hot. So be prepared for that, and maybe even consider some, those hot runs, some runs with layers, a little sauna time. And yeah, when you're here, keep those sun layers on, sunscreen, and hydrate.
Absolutely. I'll give you guys a preview of the next Hard Talk podcast. We talked with Kari Fraser, and she mentioned forgetting her sunglasses at one point during Hard Rock. She handed them to crew at night and forgot to get them back before the sun came up. I have done the exact same thing. And if you're up above tree line during the day and you don't have sunglasses, you're going to really be disappointed in yourself. Because yeah, it's a bright experience. David Fiddler, coming into the aid stations at Hard Rock, is heat exposure or sunburn, are those things that you see often? Or those things you're concerned about?
I actually I'm stationed in the gym in Silverton, so I actually don't see people coming into the aid stations, but we usually travel out to them. I haven't heard anything about that, but I will just leapfrog off of what Dr. Naughton said and just say that the problem with it's not the problem, but the issue about the Hard Rock is that the runners and their crews basically need to be prepared for any kind of weather. It could be super hot, it could be super windy, and it could snow, it could blizzard. I mean, so they need to be prepared for what they're going into. They're going into the mountains in the San Juans, and I mean they can get wind blasted, they can get really wet, they can get really hot, they can get really cold. So it's kind of that's kind of where their crews come in and make sure they have the equipment for, aid station to aid station. But I haven't heard anything about heat exposure over the last couple years, any problems with it anyway.
Hmm.
And so, and I think the aid station personnel are pretty well equipped to deal with that,
Yeah.
as
When
long as it's
when
minor.
Yeah, when we were at for my years at Handy's, when we were at the mile 70-ish or whatever, and folks are coming off of Handy's to us, to Burroughs. Yeah, it's that kind of the folks that are coming off on the morning. It can be a little bit of carnage of just, and I definitely think the heat is factoring into that. They're dry and they're just beat and exhausted, and I'm pretty sure the first year that I met Howie Stern there, he complained about the heat coming down and wanting to just lay down in the meadow and sleep in the flowers. But um,
With this dog.
yeah, yeah. So yeah, uh, we've definitely seen it there, and it takes a little bit of time for people to just kind of gather
Yeah.
themselves and get
Sure.
rehydrated and just get going down the road to Sherman.
Yeah, and just being prepared. I mean, knowing
Yeah.
that you may hit every uh, climate doing this,
Hmm.
right? You just don't know. I mean, right now it's supposed to snow tonight, um, and then it's going to be dry again. It's been 70 up here, 65 up here for the last week.
Yeah.
Then, of course, now we're going to get a big snow right when I'm trying to have a yard sale.
Wow.
Not fair. I could have picked any Saturday,
Yeah.
and of course, it's this one.
Well, wait until July when all the hard rockers are there, and
I could sell couches.
yeah, for sure.
No, the problem it's in Durango, and the problem is they have their spring cleanup on Monday.
Ah,
So whatever we don't sell on Saturday goes to spring cleanup.
gotcha.
So we can't wait another week. Anyway,
Um, so I'm interested in what's happening at the aid stations and Dr. Naughton, you've volunteered there at the aid stations. You may be in a better position to answer this question, but I have talked to some runners who maybe with Hard Rock, definitely in other races, they have been less than honest with the medical staff at the aid stations because they were afraid that as soon as they were introduced to the medical person at the aid station, they're going to get pulled from the race. That person's going to cut their wristband and they're going to go. And so they've been hesitant to ask, for a Band-Aid, or they've been hesitant to ask for, can you check me out, make sure my heart rate isn't as high as I think it is, that sort of thing. What would you tell? I mean, I know it's easy to say, hey, you've got to be honest to these people or else they can't help you, but are they really being scrutinized and they're likely to get cut if they even talk to the medical folks?
Well, at least at Burroughs, I mean, we're smaller, so and there's no crew, so it's pretty intimate, and we're watching you. They they're not gonna maybe know that we're medical staff. We like to dress up at Burroughs, so you don't
Could be
have
dressed as
medical
Jesus,
vol
I think.
Right, exactly. It could be an 80s prom, who knows? So yeah, you're being like watched and everyone's kind of eyeballed. And if you've kind of haven't spotted someone, but that volunteer that's working with them individually or the aid station captain kind of says, this person's acting a little bit funny, we'll just kind of observe first. So then you see someone who's, they're not hiding anything. They're just doing what they're doing, and you're just kind of just watching them and seeing what's happening. I mean, I've definitely had some people who've been outspoken and said, I haven't like peed in hours and hours and I'm a little worried and I'm just going to sit for a while and can you keep an eye on me, or someone whose breathing didn't feel good or whatever. But yeah, I think at least in some of those smaller ones, you're whether you know it or whether you want it to happen, you're being watched.
Yeah. But but Dave, we're not medical staff are not looking for excuses to pull runners, right?
no, no. What I was going to say is that I think the aid station medical, the higher certified medical staff are going to be looking for life-threatening injuries, life-threatening symptoms and signs, and watching them. And of course, the runner want to keep running, obviously, and we want them to keep running if it's safe for them to do so. The secondary thing we have is that if the runner wants to continue running and we're a little bit suspicious of what's going on, but it's not so bad that they can't make their own decisions, we'll call ahead to the next aid station and say, keep an eye on this number because they came in with this and they're continuing to run, but let's keep an eye on this person. And so communication amongst all the aid stations is always there. We don't usually have to use it because most people are pretty good at doing this. But if we had somebody coming in with difficulty breathing or, as somebody said, chest pain or something like that, yeah, let's keep an eye on this person. And then this year, I think we have a couple other things we're going to be doing that's going to also address this. We're instituting, Dale, correct me if I'm wrong, we're instituting kind of a sweep system where we're going to have race personnel running behind the last runner to make sure Nobody is in any danger whatsoever. We're still doing that, Dale. Is that
Mhm.
correct?
Mhm.
Okay. Yeah, I mean, and that should cover a little bit of that. If the last racer on the course drops in the middle of two aid stations, we're going to find him.
Yeah.
You
Yeah.
know, so I think we have to trust our medical personnel at the aid stations, trust our assessment abilities, and know when to pull the plug.
And Chris, to your question too, and I think I'd like to go back to what Dr. Naughton said. This is not um, save for a few at the very front. This is not going to be a 24-hour effort. This is going to be 36, 37, 40, 42 hours. And so if it means that that somebody's going to sit in an aid station for an hour to recover, that's perfectly fine. Because we have seen, I mean, all of us who've been around Hardrock for any length of time have seen runners rising like, out of the ashes and finishing, with rest and recovery and medical observation and a little bit of medical intervention. But to your point, and Dave, I'm glad to hear you say that. We're not here to take people out of Hardrock at the very first sign of trouble, because we know this is a journey, and there's ups and downs to this journey, and so we'll watch and we'll make sure they're safe, but I don't think anybody should feel that they are putting their effort in danger by interacting with our medical crew. I would hate for that.
Absolutely. Dale, how many runners are entered in Hard Rock this year?
146.
How many finishers posters do you want to give out on Sunday?
I would love to give out 146.
Exactly. That's
Yeah,
everybody involved wants to see
right,
146 posters given
right.
out. So
Yeah,
no one's looking for a reason
right.
to pull you out.
Yeah.
Absolutely, absolutely. There was one other question that was sent into us early, and actually a couple of other. I do see two more. So I'll go back to uh, being out there on the course. And Dr. Naughton, maybe this is as a hard rocker, this is similar to your wet foot question. How important? Let's say one of those monsoons hits, and and people are getting wet out there on the course. How important is it for them to change into dry clothes after one of those afternoon thunderstorms?
Um, So I've definitely had a couple of experiences where hypothermia was a thing where I've worried about myself, like finishing a race, like getting that cold where you start shivering and everything. But I did see that question, I thought about it, and I guess there's a couple of different levels. If it's the afternoon, you get wet, you're maybe going downhill, you're, heading down to Telluride or something. Um, and it's still warm. You're not going to get chills. Sure, leave those wet things on, as long as it's not going to cause some chafing, because some bad chafing could be problematic. So but not a big deal to not change a wet shirt or something. It could dry pretty quickly, especially with low humidity and afternoon sun or something. But I would say that later in the race, and when you're climbing and you're going high, and if you get wet, and like my ability to thermoregulate kind of gets a little bit wonky later in the race. And I remember going up Grand Swamp Pass 2 years ago, and you're sweating bullets going up, and then got to the top, the sun was just going down, there was a wind coming over the top, and it was like freezing, and myself and my pacer were like immediately shivering. Put on, like, I always carry a light down layer just in case for moments like that. And we're like, all right, this is great sunset, but let's get the heck out of here. It's cold. Probably quarter mile, sweating bullets again, but you just don't know how fast you're going to travel right at the top, when you are high, like how long you're going to be up there. So, yeah, don't underestimate, what it's going to feel like or how cold you can get. And if wet layers are going to contribute to that, I think change when you are somewhere that's appropriate to change, like lower down in shelter that you're not exposed to more elements. Just don't get cold.
Yeah, yeah, absolutely. Um, David, we heard Dr. Naughton talk earlier about uh, altitude, and someone asked the question about if we would advise them sleeping at altitude if they get to the San Juans early. And I have heard of people who try to drive up into the passes and sleep up high. I'm here in Florida. I'm committed to sleeping up on the second floor of my house until I head out that way. But would you say that ought to put me at about 20 feet above sea level? Um, but would you say there's a benefit to that once people are there in Silverton? Do they need to go higher than that? Is there a benefit to that?
My experience here, having worked on the ambulance for a decade here, is that number one, altitude sickness is kind of a squishy thing because I've dealt with 90-year-olds that don't even get affected at all. And I've dealt with 18-year-old football players that are crying because they're in such misery. So you really can't tell who's going to be affected by altitude. But my guess is, and Dr. Naughton, you can chime in here with pathophys, but my guess is the longer you're at a certain altitude, the more acclimatized you're going to be. 2 weeks, I don't know how much good that does. I mean, I've been here for 34 years, and even when I got here from Las Vegas, I never felt the altitude at all. I still don't. And but I think as far as runners go, and they know, um, if they can get up here a couple weeks early and just sleep at 9,000 feet, it's probably going to be beneficial, even if it's not statistically relevant. It probably will be. Dr. Naughton?
Yeah, I think, yeah, like you said, it's different for everybody, and it's not just black and white. I think, yeah, if you can sleep in Silverton for 2 weeks and then you're going out every day and you're getting higher doing like hikes and runs, yeah, that's great. And I think just even over 2 weeks, you will feel less just those symptoms of just being short of breath and like yeah, the strain of running or going uphill at altitude. So you will settle a little bit, and just to be patient with that too. I think I've had some people who kind of freak out a little bit when their heart is racing, it's like pounding in their head, and they're feeling short of breath, going up 12,000 or up handies or whatever. And it's like just like stop and take a breath, slow down. You have time. And as long as you're not getting anything beyond that, the headache, the nausea, anything like that. But yeah, I mean, you're gonna, unless you're a lucky one that doesn't really feel it, you'll feel the altitude.
And at
But
at the very least, if you come if it's your first high altitude run, at the very least, if you come up here for 2 weeks, let's say, and the first 3 days you start getting sick, you know
mhm,
you're not going to do well
mhm.
unless you can push through that and it goes away. But if you run up Kendall and you're miserable at the top, yeah, you may be reacting to this. Your body may be reacting to this.
Yeah, and I think you need to reset your final preparations. If this is your hard rock and you're used to your first hard rock and you're used to, my training is, my last long run is going to be 20 odd miles. And yeah, that's going to look different in the
Yeah.
San Juans. You might want to think about like just time on your feet, and that might be 12 miles, but
Yeah, you
with
could go
great
down to
climbing
Lime
or,
Creek and run Lime Creek, where you're only
yeah,
at
like,
Or
8,000.
you could show up at the end of June and you could go on our course orientation hikes that are
Bingo.
happening for Camp Hardrock. That would be my recommendation. That way you're at
yeah.
least
You
sleeping.
took the words right out of my mouth, Chris.
I know how to self-promote. I
Yeah.
absolutely do. I want as
Yeah.
many people as possible on those course orientation
Can
hikes. Um, yeah.
Yeah,
Yeah,
I was
maybe
going to
don't
mention that
don't.
if you're listening and you don't know what Chris is talking about, Chris does an excellent job of previewing the whole course at a pedestrian pace. He will lead hikes for he will hike the entire course, tell you with story upon story, and some are true, some are made up, and but you get a chance to see these issues, sun issues, and as Dave said, the changing climates and things like that, but you also become familiarized with the course. So
Absolutely. So we definitely
can I
want
can I add one more alternative to this altitude discussion? If you looked at your last Tommy Knocker's Tales, uh, Hypoxico is one of our good partners, and they want to make their services and their products available. And this is what they do. They take people and through tents and things like that through their products to get you acclimatized. If you can't come out, we'd love to have you here for 2 weeks. We'd love to have you enjoy the San Juans, but we also know that there's probably some other responsibilities that you may need to pay attention to. And so Hypoxico, check your Tommy Knocker's Tales because they offered a discount for Hard Rock runners.
absolutely. Their systems are fantastic, and if it's not something that a person wants to invest in, purchasing a system, you can rent them as well.
Mhm.
And I can speak from personal experience in 17 finishes that their system is very helpful. So you
You know,
bet.
I got a visit from, I don't know, Dale, if you remember Andy Gleason. He used to be the avalanche forecaster here,
Hmm.
but he came by this afternoon, and I guess he was over in Telluride, and apparently in Telluride now they have a company that installs hyperbaric chambers into your house. So like a bedroom would be a hyperbaric chamber. So that's something Hard Rock might look at. We could have one in the gym, and
You could
people
have
with
it in the school
right
beside
in
the
the
nurse's
school.
office. I'm right in the nurse's office
Exactly.
right
If you have what looks like altitude problems, you put them in the hyperbaric chamber.
That's
now.
the opposite of what Hypoxico does. Um, so we're right at an hour, and but I do want to take the opportunity, just as we did earlier, for ask our remaining panelists. Starting with you, Dr. Naughton, is there anything that you wanted to make sure people hear from you or today regarding any medical considerations for Hard Rock that we haven't already?
um, well, I think again, just don't pack light. Again, going back to it, it's not a sub 24-hour race for the majority. And, be prepared. It can be a long time between aid stations. So, think along the lines of those European races that actually have required, lists of equipment that you should have in your packs and, your socks, extra layers. If you're going when you're going out overnight and you're going to be going higher, have that warm layer because it can make the difference in a finish. So don't pack too light and just slow down and take your time if you have to. Yeah, like a finish is an amazing achievement. And then once you get it figured out, if it's your first time or if you're like me, it's going to take multiple times to figure out how to do it, how you want it done. But yeah, just take your time and bring the things you need. Don't be left out there, without what you need. Don't rush.
Awesome. Thank you. Good advice. David, anything you would add?
Yeah, I have two comments. Number one, Dr. Naughton, did Dr. Hughes punt the race off to you this year? Not yet. He usually does. He's usually got something else going on. Doesn't matter.
Okay.
And the biggest thing I think for my position is communication. I mean, it's not only communicating with Dale, it's communicating with the ham operators, the incident command, the race, the the things,
Aid
Aid
stations.
stations.
aid stations. Obviously, always communicating with them because from my perspective, I coordinate what ends up happening. I'm not there. And so I can't see the patient. And so really solid communication between here, Telluride, Uray, all the other aid stations, and making sure that the racers, as we already spoke about, don't hide their signs and symptoms and problems. It's like we're not trying to kick them out of the race. We're trying to keep them alive. And if we see something that's going to make us a little wishy-washy on their actual health, yeah, we're going to look into it. And then my job is to ensure that I get a hold of you or Dave or whoever the physician is here and say, this is what's going on. We need to make the best decision for the race, for the person, the runner, their crew, and that's kind of what I do. And so I would say just making sure everybody's as honest as they can be. They're not getting kicked out of the race. We just want to make sure they're okay.
Absolutely. Absolutely. Thank you so much. Brad Bishop, on behalf of the aid stations in total, do you have anything that you would like to add tonight?
Yeah, I don't want to take last word over the actual doctors. I'm nowhere close to that. But two things I wanted to mention. If anyone remembers the High Altitude Performance Lab from Western State University in Gunnison, they have some incredible research on the questions about timing of transitioning to altitude, bodily changes, adaptation. There's actually times their research basically said if you're looking to perform at altitude 72 to 96 hours after you arrived, you will do worse than if you had arrived the day before or a week before. There's actually a dip before your acclimation comes back.
Wow.
I'm not up on the latest, and I don't want to contradict the docs, but that piece has stuck with me. And then personally, from my experience, as far as staying at altitude, quality of sleep trumps altitude acclimation. If you're sleeping high, but you're sleeping crappy, that's going to be worse for you than if you're sleeping low, but sleeping well. So consider that after you get to altitude.
Good point. Good point.
Good point.
Dale,
Very good.
yeah. Dale Garland,
Chris Twigs.
what say you, sir?
Yeah. I think to kind of put a bow on this whole thing, we are as an organization committed to the success of every runner. At our aid stations with our medical people, that kind of thing. Every runner is well supported from start to finish, with medical knowledge, medical know-how. Again, we have an embarrassment of riches when it comes to people with knowledge about these things. And so I just want to make sure everybody knows that there is a huge support system in place, whether it's Dave Fiddler in the Silverton Gym or our search and rescue crews or our emergency response crews or our on-call helicopters or whatever. Medically speaking, we are going to do everything we can to A, help you succeed, and B, make sure you're safe while you're doing it.
Absolutely. Absolutely. We are so excited about Hardrock this summer. We're so excited for all of our panelists that have been here. Thank you very much. Dr. Naughton and Dave Fiddler, thank you very much. Brad Bishop, thank you for chiming in as well. And of course, Dale Garland. This has been a great talk. If somebody has a question that wasn't answered here, obviously reach out to us, and we want to answer those questions and let you know what you can expect. And once you get into Silverton, you can seek out any and all of us to answer questions. We look forward to welcoming all of our Hard Rockers and their families, the crews, and the extended Hard Rock family to Silverton, Colorado this summer, because in July, Silverton, Colorado is where Hard Rockers belong. So we'll see you in
That's
Silverton.
right. Right.
Thanks,
Bye,
Chris.
everybody.
Thank you.
Bye.
Thanks.